name is Tatio Saningo, and I'm a clinical dermatologist. Yeah. So, skincare is something that needs a routine. And as a dermatologist, I can tell you for a fact is that we need to discuss skincare in terms of daily regime. And it's something that is so simple. I always tell people it doesn't need to be very expensive. You don't need to complicate it, okay? Small nitty-gritty here and there works very well for skin. I always tell you when you wake up in the morning, you have a day routine and you have an evening routine. So when you wake up in the morning, I always advise maybe you cleanse your face or just wash your face with clean water. And then after that, you moisturize your face and you use a sunscreen. And you can go. Then when you come back at maybe in the evening, the thing that you need to do is you cleanse your face, and then of course you moisturize your face, and that is it. It can be very simple, but of course there are other things that we can add at least, but the basic things always might be very simple and make it a routine. We are Africans, what I can say, and I live and practice in a country that is in the tropicals, and being in the tropic means that we are not immune to sun damage. There is a lot of sun, and that means, of course, most of us are majority type 6 skin type, and except the very few that have gone to type 5, majority of us are skin type 6, which are common for pigmentary disorders, of course. This includes things like acne, this includes things like melasma, and other post-inflammatory hyperpigmentations. So, you need to analyze your skin well and know, get an expert to know your skin type. Probably a dermatologist can be the best person to advise you or maybe tell you how your skin type is. So for oily and combination skin and sensitive skin type, if you were this person, so in terms of skincare product, go for chemical ingredients rather than physical ingredients. But if you have dry skin combination and normal skin, then you can go to physical ingredients. And this is something that most of the patients there outside don't know or don't have ideas. So you just go to a cosmetic shop or maybe a pharmacy and you get a product that might not work for you. It may be very expensive, but might not work for you because your skin type by then is not ideal for that. I always tell us, climate is something that is very significant. We cannot avoid it. Even as you see what the president told us, some few weeks ago, we were having this campaign on Panda Mti, because climate is something that is very important. Environment really determines us. And I like what you call intersectionality, because it affects us. And skin is one of the health issues that might be affected because of that. In this regard, we are talking about the issues of ozone layer depletion. And what we're experiencing right now in Kenya, we are having flash floods, we are having drought that is prolonged, and of course now we have been told we are going to have El Nino, and of course we have seen the short period of rains that are there. It's something that happened 30 years ago. So the ozone layer is so much depleted, and because of that now we are more exposed, our skin is more exposed to the ultraviolet radiations. So we usually have a lot of ultraviolet. We have ultraviolet A, ultraviolet B, and of course C that hits the earth. And evidence has shown that they can penetrate even the windows and the glasses, even at your house, in your bedroom, when you're opening your windows. The sun that can you can really get photo damage because of that, and that is the reason why we advise people to use sunscreen always. So we don't really get skin cancer as an adverse effect, but of course pigmentary disorders are one of the things that we really get. Things like melasmas, acne. We have seen a lot of people getting acne, of course, that as a result of that, and usually a bit tricky to treat it. And of course, your skin, it means that when you have sun damage, then your skin is exposed to several damages. And then because of this, then you tend to get a lot of damage in your skin, okay? So these are small things that we can get here and there. But when you have sunscreen and use it correctly every day before you leave your house, we advise at least 15 minutes prior to leaving your house, apply a sunscreen. And it doesn't have to be a lot, because we have what we call sun protecting factor 30. We have the one that has SPF 15, 30, and 50. And even right now, we're talking 60 plus and even 100. We have what we call the advantage about us blacks, and of course I'm talking in that aspect because I'm Kenyan, and the people who are living in the tropics, and of course we have skin type 6, so we have not necessarily have more melanin that, like, as compared to the whites, but we have what we call we tend to have what we call a melanosome. And this melanosome, the whole human origin tend to have the same melanosome, okay? Usually, like 30 keratinocyte to 1 melanocyte. And that is the same, but ours is more dispersed, and that is where, more dispersed and wider, and that is where the melanin is stored. And that means at least we have what we call a sun protecting factor. We have at least 15. So when we tell you to use now a sunscreen because of that, then what we are advising is use a sunscreen, at least sun protecting factors 15. Don't buy much. It doesn't have to cost you a lot. Just something small, so that you're able to protect your skin. Yeah.